United Nations recognized sickle cell disease as a global health problem, and they labeled it one of the world's most foremost genetic diseases. So it set aside a date, the 19th of June each year, to celebrate the World Sickle Cell Awareness Day. This year, Hero Cameroon is bringing to you a view of sickle cell disease from many individual eyes, from many angles and perspectives. Sickle cell is real and preventable. Listen to these people tell their stories. We are shining a light on sickle cell disease.
We have sickle cell disease. Sickle cell disease is not one which can be contaminated like common cold, but it is genetically inherited from our parents. One of the biggest challenges faced by sickle cell patients is crisis. These crises are mostly caused by unfavorable conditions like cold atmosphere, infections, stress, and dehydration. That is why a sickle cell patient is required to always stay hydrated, avoid doing strenuous activities, and wear a pullover if necessary, and above all, should always stay in his or her medication. Which is why I would like to take this opportunity to plead to our families and to our friends. Staying healthy also depends on the environment they put around us. We didn't make ourselves this way, so they should shower us with more love and attention, because it will help us to overcome this crisis. And to all the sicklers out there, we should always remember that we are stronger than what we think we are. We are warriors.
I'm a sickle cell carrier. I actually discovered it last year during the screening campaign organized by Hero Cameroon. As a sickle cell carrier, I have no symptoms or manifestation of the disease. In fact, I have a normal life, but I'm fully aware that I can pass the gene on to my children. It's funny, but now, when a guy tells me he loves me, I ask his sickle cell status, because it's one of the most important things, one of the first things that comes to my mind when it comes to choose a partner. So I urge all the youths to get tested and know their status.
I'm a mother of two handsome boys with sickle cell anemia. Yes, before you ask me, I didn't know my sickle cell status before marriage, and it's a mistake I don't want you to make. I must say, my challenge as a parent with sickle cell anemia is me watching my child go through pain, watch my child abstain from school, see my child taking drugs every day. 60% of my time I spend in the hospital, so it's not really easy. The agony is too much, the pain is too much. I cannot take this pain away from my children. My tears cannot take away the pain from my children. The money cannot take away the pain from my children. So it's really difficult. If you are AS, look for a man that is AA. Love is not an excuse for you to bring children in this world to suffer. Our forefathers could be excused. Our parents could be excused because they had no knowledge. But now, what is our excuse? To all mothers out there, I know that it is not easy, but fight for the health of your children. Please, please, my dear people, check your genotype before starting your family. Thank you.
I have sickle cell disease. Well, the good news is it's over 3 years I haven't had an attack. When I was diagnosed of sickle cell, I faced a lot of challenges. I felt pain all over my body. I couldn't attend classes. When even I was in school, my friends mocked at me. But here I am, strong and healthy, because I drank a lot of water, I took my medicine serious, and I ate a lot of vegetables and fruit. So I advise you all out there to do same. For all of us out there, I advise you to do an STD test to know your status, so as to prevent giving birth to sicklers and the challenges we all face. Thank you.
Hi everyone, my name is Ali. I've been on this journey since I was 3 years old. That's when I was discovered to have sickle cell. That's not been an easy road, but with family support especially, it has been possible. It comes with a lot of challenges. For example, I lost my hearing. My speech got affected because of sickle cell. So there have been so many other challenges first. The hospital and out of the hospital, but the most daunting challenge has been dealing with lack of dealing with a recovery room of our has not been easy. Okay, today I'm happy I'm able to overcome that. So my advice is to warriors who are dealing with any kind of challenge, especially those dealing with life ourselves. Yes, we have to keep fighting. Chin up. It is not easy, but it is possible. And for the people out there, empathy goes a long way. Sickle cell disease is not witchcraft. It is a genetic blood condition. Knowing your genotype goes a long way to avoid having children born with sickle cell. Thank you.
Sickle cell disease is an inherited blood disorder which has been in the world for a very long time now. It has multiple complications, some of which are acute and chronic. Some of the acute complications are anemia, usually severe, and pain disorders such as acute chest syndrome, bone pain, priapism. Some of the chronic complications include avascular necrosis of the hip joints, chronic leg ulcers, functional splenism, just to name a few. Most of the complications, which are the acute ones, are the ones which we see regularly in the hospital. We have had multiple cases of patients who are sicklers who come to the hospital at least 3-4 times a month for the pain syndromes especially, and at times also anemia. And this brings about people rushing left and right to look for blood, fluids for the patients, and we find ourselves giving the children a lot of pain medication because the pain can be very severe. In my experience, during consultations, when I ask most of my patients, the young ones who are still of productive age, if they have done a test to check their sickle cell trait or status, 80% of these people are not aware of what I'm even talking about. So I'm encouraging all the youths of reproductive age, those who are married, who have even had children before, and those who are still thinking of getting married, to come and do their hemoglobin electrophoresis and be aware of their sickle cell trait, because this disease is one which is difficult to live with, and we would like to eradicate it from our society. Earlier the better.
Shine the light on sickle cell anemia.